Have you recently been diagnosed with a pelvic organ prolapse? And now you may be wondering, can my partner feel this prolapse when we're intimate? What is this going to do to our sex life? If so, you are not alone. My name is Dr. Brooke Kolisiak. I'm a pelvic physical therapist who is passionate about helping people break free from pelvic health issues like pelvic pain, bladder leakage, and pelvic organ prolapse. Today, I'm going to be talking to you about 4 things. 1, what is a pelvic organ prolapse? 2, should you be sexually active when you have a pelvic organ prolapse? 3, can your partner feel the pelvic organ prolapse when you guys are intimate together? And 4, what are some sexual positions that are going to make things more comfortable to be sexually active with your partner? A pelvic organ prolapse is when one of the pelvic organs, the bladder, the uterus, or the rectum, tips into the vaginal canal and starts to create a bulge in the vaginal canal. So there are many different types that can occur. So if we look at the diagram here, this one's normal anatomy here, where our bladder, our uterus, and our rectum are 1, 2, 3. This picture here shows that the bladder is tipping back into the vaginal canal, and that's called a cystocele. In this picture, the rectum is tipping forward. That's called a rectocele. In this picture, the uterus is coming straight down into the vaginal canal, and that's a uterine prolapse. There can even be a situation where the small intestines start to come down and come in between the bladder and rectum and vagina and can start to push out into the vaginal canal. And even if you've had a hysterectomy and no longer have a uterus there, you can get a vaginal vault prolapse where the vault of the vagina actually starts to tip down and inside out on itself. So those are the different types of pelvic organ prolapse. And depending on the type of prolapse that you have, you might feel different symptoms. So some people notice a bulge or feel pressure or heaviness, especially at the end of the day. Some people have difficulty having bowel movements. They don't feel like they can evacuate their bowels all the way. Other people feel like their bladder isn't emptying well, or now they're dealing with urgency, frequency, bladder leakage. Sometimes people describe it as feeling like a low kind of pelvic pain or low back pain, hip pain related to the prolapse. So there can be many different types of symptoms associated with prolapse, and every person is kind of individualized with what they feel and experience. Now, many women feel that they cannot or shouldn't be sexually active if they've been diagnosed with a pelvic organ prolapse. They may fear that this might make the prolapse worse or that their partner can feel the prolapse, but I'm here to tell you that you can still be sexually active with a pelvic organ prolapse, and it may actually be beneficial for the area. When we are sexually active and aroused, that signals our body to send a good amount of blood flow down to that pelvic region. So everything kind of gets engorged and filled, and we're able to have that kind of arousal, and that gets us ready to be able to orgasm. And when we orgasm, we get lots of back and forth contraction of the pelvic floor muscles, and so we get activity to this area. So it actually, like sex, can act like a form of exercise for the pelvic area. And if we're dealing with a support problem, that's what prolapse is, we want to make sure that the pelvic floor muscles are working optimally. And so when we're sexually active and those muscles get a workout, that can actually be beneficial for the prolapse. And many women feel like their prolapse actually feels better after being sexually active versus worse. So that myth that you shouldn't be or you can't be sexually active if you have a prolapse is just that. Now, you might have to find the right position that works for you, but if you've been diagnosed with a pelvic organ prolapse, you can still be sexually active with your partner and find enjoyment in it. Now, women who are sexually active with their partner oftentimes worry, is my partner going to be able to feel my prolapse? Is that going to gross them out? Am I not going to feel as sexy because I've got this bulge in my vaginal canal? The truth of the matter is that most partners don't necessarily report feeling the bulge or feeling the prolapse, because honestly, it is a soft, movable mass. So as your partner slides into the vaginal canal, the bulge that's there just kind of moves up and out of the way. and makes way for insertion to happen. So you can test this yourself if you want to use a vibrator or kind of using your finger, sliding your finger in or the vibrator, and you can feel how the prolapse kind of just moves out of the way. Now, there are certain positions that you can try to make this feel more comfortable for you or less symptomatic, less bothersome for you. But let me just say right off the bat with it that your partner most likely is not going to report feeling your prolapse at all. And even if there is a bulge in the vaginal canal, it is a movable mass that can simply slide out of the way as your partner slides in. So oftentimes I recommend let's just use some good lubricant and get in some good positions that we're going to talk about next to make it easier for your partner to slide in. If you're dealing with a pelvic organ prolapse, what position you have sex in can make a big difference to what you feel. One of my favorite positions to have women try is to have the woman laying on their back with their butt propped up on 2 to 3 pillows so that your butt is up higher than your head. Because in this position, what that does is it helps to kind of get the pelvic organs to tip back up and into their rightful place and kind of lessen the bulge. And it can make it easier for your partner to slide in and you as the person with the prolapse to feel less pressure and less heaviness. So on your back with your butt propped up in the air and a couple pillows is a really good position that works for many people. Another one that works for people is kind of same concept, just a different position, where you start out where you're on your forearms with your butt up in the air. So again, your head is still lower than your butt, but you're kind of with your butt up in the air on your knees and forearms. And this position, again, still helps to tip things back up and into the pelvic and out of the vaginal canal and up into the pelvic area to take some of the pressure off. So those are my 2 favorite positions for people with pelvic organ prolapse to try to help minimize any symptoms that they might feel during intercourse. So any position, though, where you're more horizontal or you can get your butt up higher than your head is going to feel more comfortable. Hopefully, if you're dealing with pelvic organ prolapse and you've watched the video till now, you're feeling a little bit more comfortable about being sexually active. You should have learned that you are not going to hurt yourself if you are sexually active with a pelvic organ prolapse. Your partner most likely does not even feel the prolapse as it kind of slides up and out of the way as something is inserted into the vaginal canal. And you've learned some different positions that can be helpful where you get your butt up higher than your head to take some of the pressure away. If after watching this video and attempting some of the suggestions, you still feel a little worried about being sexually active with your pelvic organ prolapse, it may be time to partner with a pelvic physical therapist to help you achieve your pelvic goals. Thank you for watching our video. We hope you found it informative. We put out weekly content on pelvic health topics because we want people to be able to optimize their pelvic health throughout their lifetime. Make sure you like and subscribe our channel so that you're alerted when our next video becomes available.